Hi, this video serves as a guide and overview to show the activities that should be accomplished by the students at the outpatient pharmacy department at our faculty pharmacy in the community pharmacy simulation lab FF4 at level 3. So
This
this
flowchart
serves
serves as a guide for students
to show
to accomplish the
suggestion
activities
of the
during the
activities that should be
simulation lab.
conducted. For
There's
example,
11 activities
such as
screening, filling, counter
and
checking,
labeling,
dispensing,
counter
and
checking,
medication safety.
dispensing.
Then,
The
on the
allocated
next day,
time
students
is
can
only
continue
the
do the
suggestion
recording of the
However,
dangerous drugs,
students are quite flexible
provide the worksheets of
to
the
do
extemporaneous
the
preparation,
activities,
cross talks,
whether in
emergency
1
trolley,
or 2
device
hours.
counseling, and complete
And
the
then,
quiz.
for
The
the next
allocated
day,
time
since
only
they have
be
2 days
a guide
in
for the
the OPD
students.
simulation
However,
lab,
the time
they can
and
continue
durations
with
of
the
each of the
discussions on the
activity are not
medication
rigid and flexible.
activity. Prepare 2 worksheets of the extemporaneous
This
preparation,
flowchart serves
recording
as
of
a
the
guide
DD,
for
complete
students
OPD
to
quiz, and
accomplish the
device
activities
counseling.
during the simulation lab.
For screening, it's a bit different with the inpatient screening, which is in the inpatient screening, you need to identify the drug-related problem. However, to screen, to do the screening activities in the OPD, you need to identify and document any incomplete prescriptions such as the validity of the PS, the patient's detail, prescriber details, or any of the dose that missing in the PS. Record your finding in the provided logbook. Next, for the activities of filling and labeling, you can do both activities at the same time, which is you need to fill the medication based on the PS, and then you need to label the PS manually. Thus, the envelope and the sticker available for you to write down the name, the details, and what's not. Remember to snap a picture as the evidence of your activities. In any of the activities that need you to arrange, to fill, or to move any of the medication from the original places, please make sure the medication is being put back to the original location after your session, because after this your friends will be using them next for the next session. In the counter checking activities, you need to check the PS that being filled by your friends. Verify the details of the PS in terms of the correct medication and dosage, proper labeling and packaging, absence of the error or discrepancy, and then you need to document your counter checking findings in the logbook. Next is dispensing. Dispensing is one of the most important activities in the outpatient pharmacy department. You may spend most of your time to do the dispensing, counseling, and whatnot. Dispensing aim for you to ensure that you can dispense the medication with a details and proper counseling and with a proper communication skill as well. During the dispensing process, the lecturer will act as the simulation patient. Please record the activity. Please record the medication that you dispense with the details of the counseling point and any of the feedback given from your lecturer in the logbook as the evidence of your activities. Next, for the medication safety, you need to pitch some of the problem, and then you need to suggest the solution about the problem that you identify in the outpatient pharmacy department. Please make sure that you note down the key discussion point in your worksheet and support your idea with the evidence-based medication. Please make sure the problem and suggestion that you provide in the OPD session is different from what you have suggest in the IPD session. For the activity of recording of the DD, there's also the some of the dangerous drug available in the OPD simulation lab. So in the OPD simulation lab, to do the activities related with the DD, you need to identify the DD available in the simulation lab. You need to record in terms of the name and strength of the DD, the function and indication, maximum, minimum dose, side effect, and the prescriber category. Next is the activities related to the extemporaneous preparation. It's aimed to prepare and practice students with the calculation and documentation skills related to the extemporaneous preparation. Please bear in mind there's no of the compounding process that need to be done during this process. So in this extemporaneous preparation, you need to complete at least two or more is better focus on the calculation of the extemporaneous medication. Please attach the complete worksheets in the logbook. Please bear in mind that the extemporaneous preparation that you done in this OPD is different with the extemporaneous preparation that you have done in the IPD. Next activity about the device counseling. In the OPD simulation lab, we have prepared and provide you with some of the device for you to practice on how to give the counseling to the patient about the medical device. So you need to read the provided case, demonstrate the correct use of the device to the simulated patient, which is will be added by the lecturers, record the activity and lecturer feedback in the logbook. Ensure that the device chosen are different from the inpatient device that you have done during the inpatient simulation lab. Please bear in mind, still, the device counseling activities is really important and critical that related and pertaining to your OSCE session in the future. So please use this session that's being allocated to you in this HPA so that you can practice more and you can have a better understanding on how to moderate with the session, on how to counsel the patient, and on how to use the medical device as well. Last but not least is the quiz. We have provided you with some of the question to assess the knowledge on the outpatient department protocol. Please assess the OPD quiz by scan the QR code that have been attached in the simulation lab. Complete the question, and then you may refer to the reference to ensure that you able to familiarize yourself with the common references that being used in practice, some of the guideline, some of the guide that you can use. Okay, and then at the end of the activities, as you have complete your quiz, you may snap a picture as an evidence of your activities and attach the uh, um, attach the picture in your manual logbook. Thank you.